Hi, I'm Dr. Ron Miller of Pursuit Physical Therapy, and today we're talking about two types of low back pain that is most common in runners. Now, the first type of low back pain is that dull, diffuse ache that goes across your low back. It's normally on both sides. You start off feeling fine, but the more you run, the more achy it gets. Now, this is probably due to a true lumbar or low back problem. You may have a severe case of DDD of the spine, which is called degenerative disc disease, and you may have some arthritis, some bone spurs, or in more severe cases, someone who has a history of a spondy or a spondylolisthesis of it actually slips forward. These are all common causes of that dull, diffuse lower back pain. Now, even though you may have some of these conditions, it's still treatable and you can get back to running and get back to an active lifestyle. You just have to look above and below the low back and see if there's any kind of other risk factors that are present that are overloading the spine. So if you are experiencing that dull, diffuse ache across your back, pay attention to when you're experiencing it, what makes it worse. Is there anything else besides running that does make it worse? And then you can treat that and get back to running. I have seen plenty of cases, even people with a spondy can return back to running. So the second case is that unilateral back pain. It's either on the right side or it's on the left side. Now, this injury is not really a back problem. Normally, it's a hip flexor or an SI joint pathology that is causing you to get the unilateral back pain. This is easily fixable. I see this a lot in many of my runners, and normally they failed other conservative treatments because they kept treating the low back. And they're missing the true cause of this. If you're a runner and you have unilateral back pain, there's something going on with that side. So whether it's an SI joint pathology or whether it's a hip flexor problem, it's pulling on that low back, thus you get that unilateral back pain. And again, we see this is very common in runners and normally clears up maybe 2 to 4 treatments and you're back running in 2 weeks. So the two main types of back pain, or the most common types of low back pain in runners, is that dull, diffuse ache, which is normally a low back problem, and you may have some sort of predisposing risk factor that's causing it. And then the second type is that unilateral back pain, which is normally not a low back problem. It's normally a hip flexor or an SI joint problem. So I hope you found this informative. Please like us on Facebook and share this with any type of social media. If you're experiencing any of the types of low back pain that I went over today, please give us a call. Both are easily treatable and we can get you back running in 1 to 2 to 3 weeks easily. If you have any more questions about our treatment approach or about our team, you can visit us at pursuittherapy.com, and thank you for your time.